Hello, everybody, and welcome to the Melanoma Research Foundation's Ask the Expert series. My name is Debbie Chirgai, and I am the Education Program Manager at the Melanoma Research Foundation. We are pleased to have you join us today for this wonderful educational opportunity entitled Cannabis and Cancer Care, Removing the Stigma for Patients. Today, we'll be taking an in-depth exploration of the endocannabinoid system, the differences between CBD and THC, and the importance of accessing reliable information about cannabis online. This webinar will also offer guidance on how patients can confidently approach the topic of medical cannabis with their healthcare team. And just full disclosure, before I worked with melanoma patients, I also worked in the medical cannabis advocacy field for over 8 years. And so this topic is particularly important to me, as I know and I worked with many cancer patients that have utilized cannabis to help with their side effects treatment or pain management, yet it is a topic that can be very hard to navigate on your own. First, I would, before we begin, I just want to thank the University of Maryland School of Pharmacy. We are grateful to them for their generous support of this webinar and investment in the MRF's mission of helping to educate and support patients. The University of Maryland School of Pharmacy includes 2 academic degrees, a 2-year Master's of Science, and a 1-year graduate certificate. The master's degree was the first program of its kind in the nation. Students in the program learn about the clinical uses of the cannabis plant and the scientific basis for cannabis medicine, and get to interact with experts in the medical cannabis field. Before we get started, I just want to share a little bit about the MRF. The Melanoma Research Foundation is the largest independent organization devoted to melanoma. Our mission is to eradicate melanoma by accelerating research while educating to and advocating for the melanoma community. The MRF is committed to the support of medical research, to the development, effective treatments, and eventually a cure for melanoma. We know that education is critical for patients to make informed decisions about their care. We have many educational programs and offerings, and they are not only directed to patients, but we create educational materials and events for caregivers, family members, and providers. Our educational offerings include educational materials that are all available on our website and free to download, webinars, animated patient videos, patient and caregiver symposia series, and information on rare subtypes, including ocular melanoma, mucosal melanoma, pediatric, and adolescent and young adult melanoma. If you would like to learn more about the MRF, including information about our education, advocacy, or research programs, or awareness campaigns and upcoming events, please follow us on social media. We host events such as patient symposiums and Miles for Melanoma 5Ks in cities all across the country, and we hope you will join us at one of these amazing events. Again, cannot put on these type of educational materials without the support of our sponsors, so I just want to thank the University of Maryland School of Pharmacy again for their support. And if any of you are interested in sponsoring Weber, please reach out to me. So a little bit of housekeeping before we get started. We encourage you to use the Q&A box at the bottom of your screen to ask questions throughout the session. The information presented during today's session is for educational purposes, and any individual treatment questions should be directed to your healthcare provider. We encourage everyone to visit melanoma.org to learn more about the resources we have available. Also, this session will be available for viewing later as part of our video on demand series that you can also share with others. So today we're going to flip the script a little bit because normally we start with the expert and then we do the patient and then we have Q&A. But we want to make sure that we get the patient testimony today, and she might have to leave a little early. So what we're going to do is we're going to start with the patient testimony. And if you have questions for her while she's talking or just right after, put them in the Q&A, and we'll do a short Q&A with her before we move on to the presentation with Dr. Sarah. So let's get started. First, we have Elaine Stillwell. She is a caregiver and a wife of a stage 4 melanoma patient. I met Elaine at a patient symposium that we hosted in partnership with the Fred Hutchinson Cancer Center in Seattle. And she actually asked a question during the event about medical cannabis at that symposium. So of course I had to run up to her afterwards and ask if she would join us for this webinar. So Elaine, why don't you take it away?
Great, thank you for having me. And the melanoma conference you put on that we attended was unbelievable education that I didn't even, things that I didn't know were available. So thank you for having me. And I apologize for how I look. I just ran in off the pickleball court, but anyway, here I am. So in 2020, my husband, Mark, was diagnosed with stage 3B as in boy melanoma. I found a little dot on his lower chest. We thought it was just a mole. Never had skin cancer or anything like that. And when they biopsied it, it was already stage 3B. We proceeded at the University of Washington, Fred Hutch, to go through with immunotherapy, Opdivo, Keytruda. Excuse me. He did not tolerate it well at all. He was bedridden for 6 weeks after one treatment. And so the doctor said, you just can't do this treatment. So we'll just keep doing CAT scans every 4 months, and we'll keep an eye on it. Proceed into June of 2023, and he has a pain and lump, excuse me, April 2023, he has a CAT scan, everything is clear. June of 2023, he has a lump in his lower right abdomen. We go in, CAT scan, PET scan, and it is metastasized stage 4 melanoma. He had about 1 foot of his intestines removed, 2 4-inch tumors, and we proceeded then in October to start the treatment again with Opdivo. We just last month decided to stop treatment after 9 treatments. He just cannot tolerate the pain. He also is a psoriasis patient. He has had psoriasis since he's 8. So our going forward is just to watch with CAT scans and PET scans and hope it does not come back, because for the most part now, he stopping treatment doesn't mean, as you know, in the melanoma world, doesn't mean he's dying or needs hospice care. There's no evidence of melanoma in his body, but he cannot tolerate the treatment and he's bedridden and some days blah, 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 blah. So anyway, we've also started him on Skyrizi and a regimen of a low dose morphine twice a day on top of his oxycodone to help with the pain. Also, he was prescribed Ambien. And I don't have help at home, so I'm really the caregiver. I can call in help. But the night I found him in the kitchen, going through the cupboards and talking to someone, and I said, did you take an Ambien tonight? Yes, I did. And I'm like, what are you doing in the kitchen, looking in the cupboards? And I just knew the Ambien was not the answer for him from the research I've done. So I asked his doctor, can we do a CBD gummy, whatever? And we do. And it really has changed his sleeping habits immensely. And he's able to sleep and still be pretty clear-headed. He's not able to use the restroom at night. He has to use portable urinals at his bedside. He's able to get up with that with the walker. He's not confused, and then he's not confused in the morning. I could go in the middle of the night and wake him out of his sleep if I needed to be while he's using it. I'm not here to tell you which is the best one. It took us quite a bit of time to figure out what to do. And ours, we use one here. I'm in the state of Washington, so our rules are different than other states. But this one is it's a 111 THC, CBD, CBN, indica enhanced. And this one is a little bit stronger than we normally use, but they were out at the less of a 1. And I don't even know all the whole numbers. I get mixed up myself too. So, but we have not tried it during the day yet. I'm kind of looking for another CBD alternative, cannabis alternative for the day. I didn't know how to go about it until I went to the Melanoma Foundation's meeting, knowing we have support in the state of Washington for it. I also use a ointment. on his joints because he has drop foot, he's had knee replacement, hip replacement, and his joints are severely in pain. And this does help as well. And I can't speak to other states. The stigma wasn't bad here because we're fortunate that where there's a Starbucks, there's a cannabis shop. And at first, when I was going in there 3 years ago, I'd be like, oh boy, I hope my friends don't see me, and you put your hat down. Now, I meet my friends there, so I don't feel bad. So for us, it has changed our lives, how he sleeps at night. The awareness, the not fogginess, because of course the morphine and oxycodone do nothing for sleep for him. And like I said, the Ambien is not an alternative. And now when things calm down with his health, we're going back to the Melanoma Foundation at the University of Washington Hutch and look at having something during the day. But we're hoping some of the pain will be relieved now that he's stopped treatment. So that's pretty much our journey. And it's sad to say we live in a Seattle area, which everyone thinks it's rain and gray all the time, but there's a lot of melanoma here. And we're fortunate that we live and are able to be treated at the Fred Hutch. It's a first class, top-notch place and a lot of resources, especially about even the cannabis. It really does make a difference. It really in our lives. So if anyone has any questions.
Thank you for that. We'll wait a minute or two to see if anyone has any questions, but you really, I think, answered a lot of questions already. I appreciate that you said, it kind of took you a little while to find something that worked. I think that's really important to stress with people because a lot of times people will try one thing and it might not have the effect that they want and then they'll give up. But with cannabis, there are different varieties and different types. And, it's important to find the right dose for you. Did you have any trouble actually finding a dose that worked with him? I know you were talking about the type of cannabis that you use, but did you know any information about how much to give him?
Well, I kind of looked on it. My daughter's friends helped me. They're in their 30s and they really were helpful. But I do know today I just got a little higher dose of this because the other one still wasn't. He's a big man. He's 6'3", 6'4", 220 pounds. And I try this once in a while too when I need it. But yeah, the dosage it's been a juggle. And we also stopped in a cannabis shop in Oregon because I wanted to see about getting, we were traveling and I wanted to see about getting something to help him during the day that would not be I don't know the right words when I'm speaking about this, but that would not be a hallucinatory thing, just to kind of help with his pain, just pure CBD. He didn't like it. So then he said, I'm not going to do it. I don't like it. It gives me a stomach ache. Well, I got to get over that hump with him and see what will work during the day. So, because he's uncomfortable all day and in pain all day. So, but we're going to get there. We're going to get there.
Yes, that's great. And just to be clear, cannabis doesn't really cause hallucinations, but I think what you were looking for is like intoxicated.
Yes.
We like to use the word intoxicated. It makes you feel a little funny. And so, yeah, not all, and feel free to jump in, Dr. Sarah, but not all cannabis makes you feel that way, which I think a lot of people assume.
I think there's not a lot of information out there, and especially for someone like me who's 71, who was at the advent of marijuana use and cannabis use in college and all that. I have a different mindset, and it's all new to me, and I think it's wonderful to have people in the medical field that can actually explain that to us because it can be very confusing.
It can, and I'll just pop in and say that, the cannabis that's sold in dispensaries and cannabis shops today is probably really not the same as, the cannabis that you might have been familiar with when you were younger. There are a lot of different products. the levels of THC, which is the component of cannabis that can make people, feel intoxicated sometimes or confused, tends to be higher in products that are made today. So it's great um, to seek help, to learn, and to start low in terms of dosing. Start low and go slow is what we always say.
Awesome. That's right.
Well, unless there are any other questions, there is a question, but I think that's probably better for Dr. Sarah. I'm sorry, did you want to say something, Elaine?
I did say that I can't speak to other parts of the country, but in Washington and all the doctors we've seen, they have all said to my husband, try Eastern medicine, try Western medicine, try cannabis, try anything. We are open to supporting you in all those choices. So I feel very fortunate for that.
That's wonderful. And you do have amazing doctors there at the Fred Hutchinson Cancer Center. What a great team there.
Mm-hmm.
Well, I'm so happy that you were able to find something that's working for your husband, that you were able to kind of get past your own stigmas and what your friends thought to, do something that would help your husband. And I think that's what's most important. So thank you so much for coming on and sharing your story. And please stay on for as long as you can. I know you might have to jump off soon, but please feel free to stay on.
Okay.
Okay, well, now we're going to move on to Dr. Sarah. Dr. Sarah is an associate professor in the Department of Pharmacy Practice and Science, and the program director for the Masters of Science in Medical Cannabis Science and Therapeutic program at the University of Maryland, Baltimore School of Pharmacy. Dr. Sarah received her PharmD from the UMB School of Pharmacy in 2010. She completed a pharmacy practice residency at Suburban Hospital in Bethesda, Maryland, and a specialty residency in pain management and palliative care at UMB. She's a board certified pharmacotherapy specialist and completed a Master of Arts in Instructional Systems Development at the University of Maryland, Baltimore County. And we are so happy to have Dr. Sarah with us today.
Thank you so much, and thank you for inviting me, Debbie. I really appreciate it. I'm gonna just share my screen here, and we practiced it, so hopefully this will work right off the bat. Okay, Debbie, can you just confirm that you guys are seeing my slides there? Great, thank you so much. All right. Well, I'm excited to be able to talk to you today, and thank you, Elaine, so much for sharing your experience, sharing your husband's experience. I think that's a wonderful introduction to what I'm now going to give a little bit of a background and foundation to your experience. So what I want to do first is just give a little bit of background, bit of a history buff, and you guys are a captive audience, so bear with me here for just a couple minutes. Like some other medications that we're familiar with, the opioids and opium, cannabis actually has a very long history of use.
Yeah, I went first.
What'd you say?
It's clinically proven to block odor all day and controls odor.
Dating back, thousands of years. Let me go back here just a moment. There we go. And it was introduced to the world of Western medicine in the 19th century by an Irish physician who was working in India. And it actually was included in the United States Pharmacopoeia, which is a huge compendium of medications and drugs used in the United States. And cannabis was considered a medication in the United States starting in 1851. However, in the early decades of the 20th century, there was a lot of concern about recreational cannabis use, and that really obscured its medical uses, its industrial uses. You may have heard of, rope made of hemp and cloth made of hemp and paper made of hemp, and that really did happen back then. But this all really stopped in the 1930s when the U.S. government essentially prohibited cannabis and then removed it from the USP in 1942. THC, which I mentioned before, this is the the chemical in the plant that is what we consider psychoactive. Psychoactive is just a term that means it kind of alters your mental state. And that compound was isolated in 1964. And then scientists wanted to find out what's the receptor in our bodies that this chemical interacts with that causes an effect. There must be something in us that reacts to this THC. And so we didn't identify what that was until 1990, and we call that the cannabinoid 1 receptor. But in between 1964 and 1990, cannabis was classified as a Schedule 1 substance by the Controlled Substances Act, by the federal government. And a Schedule 1 substance is one that has a high potential for abuse and no accepted medical use. Other Schedule 1 drugs are things like heroin, and Quaaludes and ecstasy, or MDMA. But in 1996, California became the first state to legalize medical cannabis, and we've seen a snowball effect in the last 25 years or so of other states that have been decriminalizing or legalizing cannabis use in various ways. I need to, maybe update this a little bit, because in 2023, the Department of Health and Human Services recommended moving cannabis from Schedule 1 to Schedule 3. The biggest difference there is that Schedule 3 compounds have accepted medical uses. And then just recently, this past May, DEA agreed that they would move forward with rescheduling. So that's very exciting. But that's a whole other talk that I could do, and that's not the purpose of why I'm here. So I'm going to move on and talk a little bit about the plant itself and about the science of why we consider this medicine, why it works. So cannabis is the scientific name of this plant. The classic varieties, some words that you may have heard, include Cannabis sativa, Cannabis indica, and at one point there were certain morphological characteristics that distinguish the two varieties. As you can see here, the shape of the leaves is a little bit different in these two pictures, and there are also some claims that the different varieties may have different physiological effects. Things like sativa is a stimulant and it's energizing, and indica is relaxing and sedating. But really, over the last several decades or more, there's been so much crossbreeding that pretty much all cannabis that's grown today is some kind of hybrid. And so those classifications don't apply to cannabis that's being grown today. What about the term marijuana? Marijuana is a term for cannabis that originated in Mexico, and it was popularized in the early 20th century in the US. It really is a way to distance cannabis from its scientific and medical uses, to create negative associations and gain support for this anti-cannabis legislation in the 1930s, because at the time the word had racist connotations. There were a lot of people concerned about large-scale immigration from Mexico. And now, of course, cannabis and marijuana are terms that are used interchangeably, but I'm going to use the term cannabis, the scientific name of the plant, from here on out in this presentation. So don't get too scared. I know I've just thrown up chemical pictures here on the screen, but don't worry, we're going to get through this. The phytocannabinoids are compounds that come from plants. Phytoplant cannabinoid is the specific compound in the cannabis plant it's generally unique to the cannabis plant. There's over 100 of them that have been identified. The most abundant is delta-9 tetrahydrocannabinol, or THC, and then also cannabidiol, or CBD. And those are really the two main cannabinoids of interest. And if you were to walk into a dispensary or a cannabis shop, those are probably the two the two compounds that you would see the most of on the products there. And as an aside, it's interesting, I think, to consider, why would a plant make compounds that affect human physiology or animal physiology in the first place? What good does it do the plant? It's either got to be for, like as a defense mechanism, and maybe the animals eat all this cannabis and then they fall asleep and they stop eating it, or maybe it's for propagation. Animals like eating cannabis and then they eat it and they spread the seeds. We don't really know. But what we do know is that the cannabinoids are not integral to, the plant does not require them for, for growth or survival in that way. But anyway, so up at the top left here, you can see the chemical structure of delta-9 THC. And the reason that it is called delta-9 THC is because of this, see this second line in the middle there, that's called a carbon-carbon double bond. You didn't know you were getting a chemistry lesson tonight. And it's in the 9 position on this ring. And if you compare the top and the bottom structures, think about, are these the same molecule? Now on the bottom, it's still THC, but the double bond has been shifted one place to the left, and now it's a different molecule. It's similar. It's called delta-8 THC. I'm going to talk a little bit more about that later. And finally, the one on the right is CBD. It looks pretty similar to THC, but it's got one major difference, and that is that it has this open ring, whereas the ring on THC is closed. And it seems like a small change, but that small chemical change drastically changes the pharmacology of CBD compared to THC. And when I say pharmacology, I mean, what are the effects that this chemical has on human physiology? So I want to talk a little bit about THC versus CBD, because as I mentioned, these are the two compounds of most interest to us right now in the medical field. So I want to talk a little bit about the differences between them. So THC, as I've mentioned, is the compound that can have these psychoactive or potentially intoxicating effects. THC products may be legal in certain states. And as Elaine mentioned, the states are very, very different with what is allowed. Some states allow individuals or adults to use THC-containing products for medical use only, or for medical and non-medical use. Some states allow no THC or low THC products only, and some, still a few, there are a few, I think maybe just 2, but very few states have no cannabis allowed at all. There are 2 FDA-approved synthetic THC products, and some of the potential side effects, as you can see here, include these intoxication or anxiety, rapid heart rate, dry mouth, and at very high doses can have some acute toxic effects like acute psychosis. CBD, on the other hand, is not psychoactive, and that's why there's a lot of interest in this now in the medical community, because it doesn't have these psychoactive effects. And CBD products can be derived, that are derived from hemp, may be legal federally. I'm going to talk about that a little bit more in a little bit, in a couple slides. There's one FDA-approved botanical CBD product. And some potential side effects, and Elaine kind of hinted at this too, that her husband experienced some GI upset and sleepiness. So those are some effects of CBD. Some commonalities that these share, both of them have potential medical uses. THC is not just for getting high, it actually has been shown to have some potential therapeutic effects as well for pain and for nausea and vomiting and other potential effects. And both of these, because they're chemical compounds, they may interact with certain medications and certain medical conditions. And so one thing that, as healthcare professionals hear a lot is, this is natural, this is a plant, and so it must be safe. There are potential benefits and there are potential risks, and nothing is 100% safe, and the risk depends on everyone's individual health history. That's why it's so important to talk to your medical team, your healthcare team about cannabis. And I'm going to get into a little bit how you might start that conversation. So I've talked about cannabis compounds, what they actually do once they get in the body. But what do they do and why do they do it? You know, these plant compounds affect us because we have what's called an endocannabinoid system. The endocannabinoid system, or the ECS, consists of those receptors that I talked about, the cannabinoid 1 receptor, the cannabinoid 2 receptor, and our endocannabinoids, which are cannabinoids that we make in our own body. That's why we even have the receptors to begin with, because we actually make these chemical structures on our own, and it's the plant that is mimicking what we do on our own. And then there are the enzymes that make those endocannabinoids and that break them down. And this is a physiological system that exists in all animal species. It's involved in multiple regulatory and biological functions like hunger and feeding, neuroprotection, mood, our immune response. And so it's a very old physiological system as well. These are our two endocannabinoids that we know of, called anandamide and 2-AG. These are neurotransmitters, which are chemicals that act on our brain cells. And when they act on cannabinoid receptors in the brain or in other parts of our body, they affect the release of other chemicals, other neurotransmitters like dopamine or serotonin. So as I mentioned, there are two types of cannabinoid receptors that we know of. We just call them cannabinoid 1 or CB1 and cannabinoid 2 or CB2. And as you can see there, these are located all over the body. The CB1 receptors seem to primarily be concentrated in the brain. CB2 receptors are also concentrated in our immune tissues, but they're located and have been found in many different organs. And that's why there is such a wide range of potential effects of cannabis in different parts of our bodies. So that really is what I wanted to talk about from the scientific angle, and really to give you a foundation of why we think this plant can be, potential medicine, how it works. But I wanted to talk a little bit and give you some context for what's going on in the U.S. and because there's a lot that's changed and a lot that is changing. So right now, cannabis is still a Schedule 1 drug, but that is changing. It's going to be moving to Schedule 3. A Schedule 3 compound is still regulated under the Controlled Substances Act. There's still a risk of abuse associated with cannabis or with any psychoactive drug, but it's less than the other drugs that are Schedule 1 or Schedule 2. Examples of Schedule 2 drugs are things like oxycodone and morphine. So cannabis will be moving to Schedule 3. The biggest deal from my perspective as a healthcare provider is that this is the government acknowledging that cannabis is medicine. How much will change, that remains to be seen. But that is one thing that is very important, is that now the government is acknowledging what many of us have known for a long time, which is that cannabis has accepted medical value. So until that happens, though, cannabis is still federally illegal, and so states have created their own laws regarding its use. And this is a nice graphic that I pulled from the National Conference of State Legislatures website, where you can see, okay, so there's 3 that have no cannabis program, I think, still. But most states have some access to cannabis products. And as you can see, there's a lot of difference between the states. And even the states that, have a medical program, those medical programs will be very different. And the processes for getting registered or certified, and how many dispensaries there are and where they're located, and those processes will be different from state to state. So I wanted to come back to hemp and CBD very quickly, and I am keeping track of time. I think we're doing okay. I'm getting close to the end here. So hemp is the term for strains of cannabis that contain very, very little THC, that psychoactive compound, less than 0.3 Now, historically, as I mentioned in the beginning, hemp fibers have been used for industrial purposes, but more recently there has been interest in extracting CBD or other compounds from hemp and then marketing those as supplements or therapeutic treatments, or even, in some cases, non-medical products. And that's because in 2018, the Farm Bill removed hemp from the definition of marijuana in the Controlled Substances Act. And that led to overproduction of hemp. And we all know what happens when you overproduce a commodity, right? The price plummets. So now you have a lot of hemp farmers wondering how they're going to make money with all this hemp that they're growing. And that is why you see CBD products in every grocery store, pharmacy, beauty supply store, gas station. And so the question really is now, how are these products going to be regulated? Right now, they're not regulated at all. The FDA determined in 2023 that CBD can't be regulated as a dietary supplement, but there's no, there's no proposed way for them to regulate it instead of regulating it as a dietary supplement. And plus, I mentioned Delta-8 earlier. Delta-8 is this THC with the double bond shifted one position to the left. Remember, that's the molecule I mentioned at the start of this presentation. And Delta-8 is psychoactive, and Delta-8 can be made from CBD, which is a legal substance according to the Farm Bill. And this is why you're seeing Delta-8 products being sold in gas stations as an alternative to Delta-9 THC. There's also Delta-10 THC and other isomers. But the problem, with this is that Delta-8 exists in very, very small quantities in the plant itself. So chemists have to do reactions on CBD to produce these THC isomers. And we don't know, because these products are unregulated, how these chemists are purifying the products. If you were to boil CBD in acid, you get a lot of byproducts. So how are they cleaning those up? We just don't know. So from hemp, again, you're now getting psychoactive products like Delta-8, Delta-10 THC, and there are sure to be others. So again, I've already mentioned this, so I won't belabor the point, but a lot of changes going on with how cannabis is going to be regulated at a federal level. Right now, DEA has put out what's called a proposed rule, which you can access in the Federal Register. If you're interested, you can read. There's, I believe the public comment period is still open, if that is something that interests you. So if you are interested in learning more, I wanted to end this with just a couple thoughts about how to make sure that the information that you're finding online about cannabis is reliable. So I wanted to have some suggested resources here, and I don't know, Debbie, if there's a way to get a copy of my slides out, with some of these links, but I'm happy to share that with you if there is, that you can share with folks who've signed up for this webinar. But these are just some websites that I've put here that, depending on what you're looking for, may have interesting and good information for you. Americans for Safe Access is a great nonprofit organization promoting access to information for patients. The National Conference of State Legislatures is a great website for updated information about different state cannabis laws. And there's the CDC, the FDA. The normal website is also well updated, has a lot of good information. And if you wanted to move beyond looking at information on the web, as Debbie mentioned at the beginning, I'm the co-director of our UMB School of Pharmacy Graduate Studies and Medical Cannabis program, which I'll talk about in just maybe at the end if there's a little bit of time. But I want to move on here to talk about a process for evaluating online resources. And I talk about this with my students a lot. We do some activities where we have them pick out, find an article online and evaluate it according to this method. And this method is just to help guide you, help you think critically about the information that you read online and decide whether this is appropriate and whether it meets your needs and answers your question. So you think about when it was published, and is it important? Is the publication date important? How old is the data? Does it give you the information that you need? And are you the intended audience for this information? Who wrote it? Is the author an expert? Were they qualified to write whatever this information is? Are the facts verifiable? Is the information backed up by evidence? And was the information reviewed by someone other than the author? And then finally, why was this written or created? Is there an underlying motive or bias? Is this on a commercial website or they're trying to sell a specific product? These are just things to think about when you're looking at information online. And then the very last thing I want to talk about is how do you talk to your doctor about medical cannabis? It can be nerve-wracking to bring this up with your doctor, depending on where you live, especially. So here are some questions that you might consider when you talk to your doctor about cannabis. And that is, does cannabis interact with my medical conditions? Does it interact with my medications? And what are the potential benefits and harms related to using cannabis as a medical treatment? What evidence supports the use of cannabis for this condition or symptom? And that's something that even if healthcare professionals don't have maybe a lot of experience working with cannabis as a medical therapy, they still have access and knowledge to interpret medical literature on their own and can talk you through this. How will I know if you decide, if with your healthcare team you decide that cannabis is a potential therapeutic modality for you? How do you know if it's working? What side effects are possible? And when should I seek medical attention if I experience side effects? These are all good questions to ask anytime you're starting any new therapy, but especially I think with something like cannabis. So finally, this is my program. We actually have two programs. There is a master's program. There's also a graduate certificate program. The link to our website is there if anyone has any interest in checking it out more. I'm going to stop sharing my screen now and hopefully answer some questions. Thanks for your patience with me, everybody.
Thank you so much. That was an amazing presentation. Please feel free to put any questions in the Q&A or the chat, and we can answer any of your questions. We already have a few that came in, so I'll just get started. A patient wrote in and said that they have vaginal melanoma and will be getting TVEC injections that are injected into the site. The pain is awful, and I'm looking for these products to help get through treatment. Which type should I look for?
Well, one, I just want to say that, I wish you the best in your treatment. And, I may not have a very satisfying answer for you as part of this presentation because I really can't give medical advice. But what I hope that I have done in my presentation is giving you some tools to talk to your healthcare team about it, because they are really the right people to be, discussing if this is an appropriate option for you, and if so, what formulations, what concentrations of things like THC and versus CBD, what things might be the best for you. As I've said, the effects of cannabis are very patient specific. They depend on your individual health history. And we think more and more now that they may be related to, to your genetics, your individual collection of different cannabinoid receptors. And so I wish you the best, and I urge you to speak with, with your medical team for advice.
The next question is one that we hear a lot, unfortunately. So this individual is from the state of Florida, where they have legalized medical cannabis. However, the process and costs involved in accessing medically is cost prohibitive, especially after the cost of cancer treatment. It seems counterproductive to say that patients can get access, but the financial barrier is difficult. Not really a question, more of a comment, but is there something you want to say about that?
Yeah, I mean, I agree. I agree with you 100%, and every state is different, but cost is a barrier to many in many states with medical programs because there are costs associated with getting certified by a physician, with potentially registering with the state regulatory body, and then the products themselves are expensive and really pretty much not covered by insurance. So it is. I don't have an answer or a workaround for that. It's possible that with rescheduling, we'll see more interest from pharmaceutical companies in developing, cannabis products that may be FDA approved, and then maybe there's a pathway, to coverage, or potentially just, having, cannabis be less restricted by the government. Maybe there'll be some movement by insurance companies to maybe cover or reimburse some of the costs as alternative, treatments. I don't know, but I'm hopeful that with this kind of movement at the federal level, that we'll start to see some of those things happen.
And I just want to add, like just to clarify, cannabis is not covered by insurance anywhere as of yet, but that is one of the things that advocates are working towards, especially to help patients, for insurance companies to cover the cost. So it's really important that that people still advocate for the medical side of cannabis. And once it does go to Schedule 3, it still will be federally illegal. Right now it's legal in certain states, but federally it's still illegal, unfortunately. So you mentioned some of the side effects, and you mentioned a little bit about some ways that it can help you, but someone asked, what symptoms or conditions specifically can medical cannabis help with?
We have the most evidence for chronic pain, particularly neuropathic pain. Also, anorexia that is associated with a medical condition that's not feeling hungry, and nausea and vomiting, especially that associated with chemotherapy. Those are the three that have the most evidence supporting the therapeutic use of cannabis. There's also, moderate evidence for the use of cannabis to treat insomnia. And I mentioned that there's the CBD, the product that is FDA approved is approved to treat serious seizure disorders that aren't treatable with other medications that typically occur in very young patients. So those are some of the medical conditions that we have the most evidence for. But cannabis is being studied for many, many different conditions. And one thing I want to say is that there is a lot of research that is being done, but not all of it's being done on humans. And that's important because animals are not humans and cells are not the same as humans. And so, but a lot of times if you read the lay literature, you see what we call preclinical research, that's animal or cell-based research, kind of extrapolated toward, this means there's a benefit in people. And that's not necessarily the case. It may be, but we don't know. We don't have good evidence until we have clinical evidence or evidence in people. So I would just say, when you're reading about new research, think, is this a study that was conducted in humans in a clinical trial, or is this a study that was studied in animals or in cells, and we don't really know yet how it works in humans?
Great point. Very great point. This is a great question. Is there a difference in effectiveness between the different modes of ingestion?
That's a great question. And I would say the major difference between different modes of ingestion or modes of administration is in the timeline of effect, right? So if someone were to inhale, cannabis to use to vape it or to smoke cannabis, then that effect, the onset of effect is very rapid. If someone eats, cannabis product, an edible or something like that, it takes much longer to have an effect, and the effect lasts much longer. And so, another, if someone, is eating an edible and they don't feel an effect, and then they eat more, then all of a sudden they might have way more effect than they wanted. So that's another thing to consider. That's a great question.
Yeah, it's important to know that the different modes of administration affect your body at different times. So it's important to know when you're taking it and how long it's going to take to feel that effect before you take it. So make sure you look into that. Is there a way to evaluate CBD products?
I mean, so I'm not sure exactly what the context of this of the question is. I mean, certainly there are ways to evaluate, to evaluate, products. Yes, there, and different states have different policies with regards to how they regulate and test products for things like, testing plant-based products for the presence of heavy metals and pesticides. There's also regulation in terms of testing products to see if what's on the label is actually what's in the product. So yes, there are ways to evaluate CBD products or regulate CBD products. But this, it's not being done at the federal level right now, and there's no standardization, which is something that we really, really need. If the context is in terms of efficacy, yes, there are also, CBD products can be evaluated, for clinical use in a clinical trial. They could be. It's very, very it's still challenging to do research on cannabis products in the United States right now. And it's most challenging to do clinical research on the products that you would walk into a cannabis shop or a dispensary and purchase, because those are not the products that, if you were a researcher and you get a grant from NIH, they have, and even if it's related to cannabis, you're getting very specific products from, government approved facilities. You're not, that may be different from what you or I or anyone else in their state could go in and actually purchase. So it's a challenge.
And another point just to note is that if you are buying a CBD product outside of a dispensary, if you buy it at a gas station or at CVS or wherever, those products, just to be clear, those products do not have any required testing.
Yes.
There's no required testing. The only products that are required to be tested are the ones that are sold at a dispensary, and dispensaries do sell CBD only products. Sometimes they're hard to find, but they do sell them there. And you can, they're tested.
Yes, thank you so much for pointing that out.
Oh, of course, yeah. Let's see, wait, there's one more. There is, two more questions. Is there a minimum dose recommendation?
So yes, there, just recently within the last year, there were some, expert consensus, kind of guidelines published with starting doses and protocols for CBD and for THC and CBD. These are, as I said, these are expert consensus. which is a little bit different from evidence, from, doses that are, based on, in clinical trials. But the general starting dose of CBD, and this is not a specific recommendation. This is information that anyone can find by doing the research on their own. But with CBD is generally 5 milligrams once or twice a day, and it's recommended to start with CBD because it doesn't have those psychoactive properties, especially if someone has never used a cannabis product or it's been a long time since anyone's used a cannabis product, to start with CBD only at a very low dose. Remember I said start low and go slow. And if with working with your healthcare team, you're titrating up the dose, meaning you're increasing the dose or the frequency that you're using it, not getting effect, then you can start to think about adding THC at, again, small doses, starting low and going slow.
The last question I want to ask you is about the entourage effect. We didn't really talk about that little. Can you describe what the entourage effect is in regards to cannabis?
The entourage effect is it's an effect where the hypothesis is that the combination of different chemical components that exist in what's called the full spectrum cannabis product or the cannabis plant itself has some synergistic effect compared to an isolated, let's just say THC on its own or CBD on its own. Because in the cannabis plant, I said there were, potentially hundreds of different cannabinoids in differing concentrations, but there are also other chemical components like the terpenes and the flavonoids, which may have, some effect on human physiology. I would say that is still something that hasn't really been shown in clinical trials. There's a lot of preclinical data out there that is positive, but again, we don't have the clinical data to support that. But that's what that is. It's the entourage of chemicals in the cannabis plant in its natural state, may be more effective than a single compound. But right now that's still a theory.
Well, thank you so much. I want to be respectful of everyone's time. If you do have some questions, I know there was one or two we didn't quite get to, please feel free to reach out to me and we can get those questions answered for you. With that, I would like to thank all of you for joining us today, and especially our speakers, Dr. Sarah and Elaine. We appreciate all that you do for the melanoma community and appreciate you taking additional time to be with us this evening. Thank you again to the University of Maryland School of Pharmacy for their generous support of our Ask the Expert webinar series. Again, this program will be available on demand on our learning platform on our website, and will also be streamed on our social media channels at a later date. At the end of the program, when you close the screen, there will be a short evaluation. It's very, very short, I promise, that will pop up in your browser. Please fill that out. It provides us with feedback on today's session and helps us create new programs for the future. Please visit melanoma.org to learn more about our upcoming webinars and other educational or advocacy opportunities. Again, we have a ton of free resources that we offer to patients, caregivers, and healthcare providers, including educational literature, a patient forum, Ask the Nurse, email, and an animated patient video series. If you have any questions that you think of later, please email us at education@melanoma.org. And thank you all for joining us today.